Welcome to another Baby Brunch video. Today we're chatting to Nikki Allorto. She's a qualified general surgeon with critical care training and runs a burn service in Pietermaritzburg, South Africa. She's involved in aspects of burn care, from research and teaching resource management, surgery outreach, and telemedicine, which is something that I had to learn about recently. Nikki, it is really wonderful to be chatting to you today. Thank you for your support, and to everyone who's making this video and podcast possible. The telemedicine thing caught my attention. Tell me more about that. What is telemedicine?
So telemedicine is where you've got a tool that can be any sort of tool. Used to be on a computer, but now there's even apps on your phone, where a doctor working remotely at a small hospital far away from a big center can directly access a specialist in almost any field.
You could have chosen any field to work in as a general surgeon, but you chose children. You chose children specifically with burns. Why is this your passion?
Probably because they chose me rather than the other way around. When I was a training doctor and we had to look after patients with burns, they were stuck right in the back ward, neglected. Nobody wanted to look after them. And I'm just a sucker for the underdog, and something about these kids just stuck. And I thought, they're not getting the right care. It's not fair. And that sort of snowballed into becoming my life's mission and my life's work.
But how do we know when a burn is serious?
So generally we look at the burn in two aspects. One is how big it is, and the other aspect is how deep it is, or how many layers of the skin that have been damaged. So, or where on your body it is. So an easy way to look at it is the palm of your hand. So the palm of your child's hand is 1% of their total body surface area. And anything bigger than that 1%, I would say is more serious, and you need to seek medical attention. Or if it's on a special area like the face, the neck, the hands, the groin or the genitals, and of course the feet. So where it is, how big it is, and then the last component is how deep it is. So the most common injury in children is a hot water burn, and a hot water burn will generally be not that serious, and it will be what we call superficial partial. So a thin layer of the skin is damaged, and the body has the ability for that to heal on its own. How we know it's superficial partial is usually by the way it looks, and it's pink and shiny and moist. And that's usually less serious. And you will see blisters and the skin coming off, but that's usually a sign that it's more superficial and that it will heal. On the other end of the spectrum, for example, what happens in the home is electrical burns, sort of loose wires or fingers going in sockets. Those burns are often really, really small. They're usually on the hands, but they're quite deep, and they sort of have a pale, leathery look about them. That's usually lots of layers of the skin are damaged, and that definitely is considered serious, and you need to seek medical attention.
How do you dress a burn? So there's a hot water burn, and now what?
So the very first thing you should do is run your child under cool running water for as long as 20 minutes.
Wow.
So not sort of just 2 minutes, literally as long as 20 minutes. And we don't want ice, cold water, fridge water. It's water that comes out of the tap. The fact that it's running is better, because you're running the water over the heat, and you're trying to cool the surface of that skin down and prevent the ongoing burning process. So if, for example, it's a hand, it's easy to run the hand under the tap. If it's a lot of the body that's been burnt, I would stick the child under a shower. So not in the bath. You don't want to immerse the hand or the child in something, because obviously the water heats up and then it's not cool water anymore. So you really want running water, and you really want to persist for 20 minutes. That's the most important, most critical step that you can do, because then you're trying to limit the damage that can be done to the skin.
What about rolling in blankets and adding a fire blanket? Often when you get these first aid kits at your corporate gift, there's some foil blanket inside and no one knows what to do with it. If there's something that is on fire, or God forbid, the child is burning, what do you do?
Okay, so if it's a flame burn and there's something on fire, you've obviously got to put that fire out, and it's the classic stop, drop, and roll. So don't run, don't move, stop, drop, and roll. But absolutely, you can put a blanket over the flames because that will take the oxygen away and the flames will die. As soon as there's no more flames, you need to remove any of the clothes, you need to remove any jewelry, and then you need to do your first aid. So back to that 20 minutes of cool running water, not ice, not cold water.
We've established that every parent should do a first aid course, and I can't stress this enough, but now we have this opportunity and we can maybe ask your advice as to what to keep in our first aid kit until we can get to that course and do that refresher course again. What should we keep? I mean, I've got one sachet of, I think, burn shield in mine, but the rest are all for constipation, a runny nose, cold and flus. That kind of overpowers the first aid kit at the moment, where I almost feel like the burns things should be a priority. What should we keep?
You know what? Burn shield is perfect. And there's not much else. Burn shield is cooling initially, so it's a little bit more comfortable from a pain perspective. So I think that's perfectly adequate to have burn shield in your kit. The other thing you can do is put a roll of cling film. So the things the patient feel is the moving air. And often then, you want to wrap your child up, but whatever cotton, clothes, or blanket can stick to that open wound. So if you don't have burn shield, a roll of cling film, and you cover that wound with cling film, and that will provide a barrier between the open air and, whatever blanket or clothes you want to wrap your child in before you take them to the clinic or the hospital to be seen. And that will be the most efficient and simple thing to do. Anything, other than that, fancier than that, actually is unnecessary. That critical thing is that 20 minutes of cool running water, and then wrap them up in cling film or burn shield. You want to keep them warm, so you want to keep them in a blanket and then get to a facility.
Even though this is not about smoke today, what to do when there's a fire, God forbid, in the house and we inhale smoke? What do you do?
There's nothing much you can do. You need to get to the hospital for smoke inhalation. But in general, somebody who is awake and, able, you need to get out of the smoke. The severity of injury that comes with smoke inhalation is linked to the amount of time that you are breathing in that hot air and that hot smoke. So, the average person who's awake, you're going to run out of the house and it's not going to be a problem. It's more a problem if you are found in a burning house, then you've had long exposure. As a mom, there's nothing that you could do specifically. You need to get to the hospital as soon as possible.
I'm thinking of adding butter to the wound. Other remedies like, you find glass, or the glue example that I used earlier, where we want to.
Not.
What are your last?
Definitely, no matter what your granny told you and assured you that it would work, don't do it. We're going to go back to the 20 minutes of cool running water and the cling film or the burn shield. That's it. Nothing else is going to offer any benefits. The problem with all these other things is that they can contaminate the wound and lead to development of an infection, which is not what we want. So keep it simple. Don't put anything else on.
Any last thoughts to our parents watching this? Because I think this is the one episode that's given me literally the shivers.
Accidents do happen and children will be children. But a couple of things: when you're running a bath, run the cool water in before you run the hot water in. So if you start running the bath, and lots of people have mixer taps, and that's fine and you could get it right. But if you don't, and you've got to run, you know, one at a time, make sure you put the cold water in the bath first, and then you add the hot water. The other thing, be cognizant of how your kettle cord or appliance cords are near an edge. You've really got to tuck those away, because grabbing and pulling that down is a common cause of the problems. And then the pot handles. So don't let the pot handles stick over the edge of the stove. You want to tuck them in and have them furthest away from the edge of the stove for, you know, those investigating little hands.
Doctor, thanks so much for your time, and thank you for what you're doing to our communities, not just in Pietermaritzburg and in KZN and wherever you work, but in the entire country and in the world. For more podcasts and information, as I referred to you earlier, go to babybrunch.co.za, but find Dr. Nikki and what she does. So go to burncare.co.za. They really have an amazing website, and you can find out more. And if you're a parent watching this, please be safe. We mean it.